Good evening. My name is Bob Elick, and sorry about that, folks. Just give me 1 second to restart this. My apologies. Good evening. My name is Bob Elick, and I'm the Vice President for Alumni Affairs at St. George's University. I'm incredibly excited tonight as we celebrate Women Physicians Day at St. George's. And what better way for us to celebrate our alumni than to have a panel of 5 women speaking about their experiences, their backgrounds, their passion for medicine, and most important, their commitment to educating themselves, their peers, and their colleagues to make a difference in healthcare. I'm incredibly indebted to the panel. I'm incredibly indebted to many women who have posted their profiles and backgrounds and experiences on our landing page. And I'm incredibly indebted to the women who are participating tonight or who have visited the landing page or will visit the landing page. It's incredibly inspiring to hear these women speak, and more importantly, to connect their experiences back to their educations at St. George's University. It's unmistakable that they care deeply about their profession, about one another, and about SGU. And with that, take it away.
Hi, everyone, and welcome to our panel discussion. We are really excited to bring together 5 inspiring women leaders for a very powerful panel discussion for National Women's Physician Day. I will be asking our panelists questions that will not only allow everyone to share their perspectives about being a woman physician, but also allow the opportunity to share the impact that female leaders can have on their organizations, and also the impact that leadership roles can have on the women who hold them. Alongside a discussion about the unique qualities that women leaders and physicians bring to the table, we'll also have an open and very frank conversation around topics such as work-life balance, flexibility, burnout, fears, strengths, and so much more. So thank you so much for joining us today on this wonderful occasion, National Women's Physicians Day. I will start by introducing myself and then have our panelists introduce themselves as well. So my name is Danielle Kroll. I am St. George's University class of 2012. After medical school, I did my internal medicine residency at Drexel University in Philadelphia. And then after my residency, I went to Washington, D.C. and completed a hematology and oncology fellowship at George Washington University. And now I'm currently a breast cancer oncologist, so a breast oncologist, and I work for George Washington University. I see patients there, and I also work for the Food and Drug Administration. And at the Food and Drug, I am a medical officer for the federal government, and I do oversee clinical trials in breast cancer. So it's a pleasure for me to be here with you guys today. So let's get right into it. I will call everyone's name, and if you could please introduce yourself, including your graduation year and where you completed your residency and where you're currently located. So Dr. Gina Puglisi, we will start with you.
Hi, I'm Gina Puglisi. I'm a St. George's graduate of 1987. I did a combined medicine and pediatric residency at St. Joe's in Paterson, New Jersey. And shortly after that, went into emergency medicine and I've been working in emergency medicine for 31 years. However, I've also been working as an adult hospitalist and a pediatric hospitalist, as well as working in urgent care and telemedicine. I am presently the regional medical director for all hospital medicine in the Northeast, from New Jersey to Maine, for Envision Physician Services, which is the largest healthcare provider in the United States, coast to coast. And so that's what I'm doing.
That's fantastic. Thank you, Gina. Next, we will introduce Dr. Angela Self.
Hi, I am Dr. Angela Self, coming to you from Dallas-Fort Worth, class of 98. I work at Southwestern Health Resources. I'm on the administrative side of medicine full-time. This is my 5th year on that side, and I'm a senior director for physician utilization management. I did my internal medicine residency at St. Paul in Dallas, St. Paul University Hospital. I actually did my internship at Medical College of Virginia, and that was in anesthesiology. I then went to St. Paul University Hospital and practiced clinical medicine for 15 years as an internist, working inpatient, outpatient, skilled nursing, hospice, every aspect of internal medicine, really. And now I'm on the administrative side. I've worked for a large health plan doing utilization management, a Medicare Advantage organization as a regional medical director. So this is rounding out my administrative career working at an ACO. So thank you for having me.
Fantastic. Thank you, Angela. And next we have with us Dr. Francis Mcgill.
Hi, everyone. Thank you for having me here. My name is Fran Mcgill, and I am the senior of the women here tonight. I was in the 2nd class at SGU, graduating in 1981. My career then led me to an internship in a small Harvard program in internal medicine, Brigham Waltham Brockton. And then I did my residency at Women and Infants Hospital, which was Brown. I moved then to Montefiore Medical Center, inner city Bronx, where I did a lot of surgery and had some programs for family medicine and physician assistants, and of course taught medical students and residents. And then I went to New York Medical College as director of the clerkship there, and St. Vincent's as director of gynecology. And for the last 12 years, I've gone home to Grenada, where I work in the Department of Clinical Skills, and I see OBGYN patients in the clinic.
Jennifer Golia.
Hi, everyone. I'm Jen Golia, class of 2009 from St. George's. I did my intern year at Flushing Hospital Medical Center and then moved on to a diagnostic radiology residency and graduated from Bridgeport Hospital, part of the Yale New Haven Health System. And then I moved on to a fellowship at Memorial Sloan Kettering Cancer Center in oncologic imaging. And that's where I currently am. I left briefly for a different job, but then was recruited back as faculty. So I'm currently working there with my specialty in colorectal cancers.
Fantastic. Thank you, Jen. And last but not least, we have Dr. Marie Rafael Jean.
Hello, Queens, far and wide. Hi, I'm Dr. Jean. Call me Rafi or Rafael. I am class of 2009 at SGU. After graduation, I went on back to my alma mater for undergrad to finish my Master's of Public Health at the University at Albany School of Public Health, after which I started my pediatric residency at, then it was called the UMDNJ in Newark. Now it's become Rutgers University. And after that, I went ahead to do a pediatric gastroenterology fellowship at Cincinnati Children's Medical Center. I'm currently a assistant professor of pediatrics within the Division of Gastroenterology at University of Arizona, Tucson, also known as Banner University Medical Center, Tucson. I'm really happy to be here with you all.
That's great. Wow. I don't know about you guys. I am just blown away by your very brief introductions and all the wonderful things that you have done in your training. And we're going to dive much more into all of those things. So we're going to begin our panel. Let's get going here. People are dying to know everything about you and all of the advice that you have for people watching at home. Let's get on with the questions. Question number one, what does leadership mean to you? And what is your leadership style? So Gina, I'm going to direct this question to you.
So, I've been in a leadership position since my third year out of residency. And somebody came to me and said, do you want to be the director of an ER? And I was like, I can't be a director of an ER. First of all, I'm not even emergency medicine trained. And I don't know anything about administration, but they said, we'll teach you everything. And I said, yes. So over the years, I've really been trained by a lot of wonderful people. And I've learned to become a servant leader. So a leader that gives to their team, makes sure their team is always happy, make sure that everything I do is for the team, because if the team is happy, then the patients are happy. It trickles down. So your leader is the person who, is the captain of the ship, makes her team happy, does everything that she can do to make things easier on a day-to-day basis, so that the people that work under me can spend more time at the bedside and less time with the rest of our career responsibilities. So I am 100% a servant leader. In addition to that, very collaborative. I never do anything that has not been discussed and then accepted and, sort of become the mantra before we roll something out, so that everybody's on board. And I think that women in general are designed for this type of leadership. And most of the studies that have been done have shown that servant leadership and collaborative leadership are the top most successful types of leadership that there are, versus a dictatorship or some of those other leadership styles. So I think that we are uniquely made for this type of thing. I think women in general, it's not my opinion, it's already been studied, that women are in general more collaborative and are better servant leaders.
Yeah, that's really a great point, Gina. I just hearing you talk, I'm thinking back to my training and, some mentors that I had who would teach me about leadership. Everyone may have their own kind of leadership style as they get into those leadership roles. What does anyone else think about that? Do you have a unique leadership style that you maybe developed throughout your training that you think someone at home would really enjoy hearing about?
I know, well, I, at my prior job, had a chairman who had a very dictatorial style of leadership. And I did not last very long at that job. I couldn't wait to get out of there. And in contradistinction to my current chairwoman, who, as Gina mentioned, that we now have 50% of women in the field of medicine, but so few of them have leadership roles. My chairwoman is such a giant in the field of radiology, yet she is so kind and caring for you as her employee. And so to go from a dictatorial style leadership to working for someone like her who understands the difficulties of being a woman and being a mother in the workforce. I was 7 months pregnant when I interviewed, and I thought that was going to hold me back. And you know what she said to me as she walked out? She leaned in and said, "Is this your first kid?" And I said, "Yes." And she said, "Have another." And she hired me. It was incredible. So when you have a leader who cares about you as an individual, more than just what you're doing for them 9 to 5, you feel like you can bring so much more to the workplace and to your patients and to your colleagues.
And I think it's important when you come in as a leader in a new institution that you don't walk in and say, "I'm changing this, that, and the other thing." You need to talk to the people, you need to listen, you need to not do a lot of big changes unless it's a critical issue, to kind of get the flavor of the culture of the place and have people understand who you are and get to understand them, and then bring the changes in. And then I think you are a very strong leader. And the other thing I would say is just, as Gina said, be open to every opportunity, but also be aware of your own your own ideas and your own prejudices and let everybody participate, because you'll get a lot of great surprises.
Yeah, absolutely. Well, Fran, I'll actually keep going and ask you a question. As a woman in medicine, what barriers have you encountered along your career path? Do you mind sharing some of those?
Well, when I started, there were very few women in medicine, and my mentors, there was one woman who mentored me, and one woman, I was a nurse first. There was one woman who was a nursing leader, and nurses then didn't want people to move careers into medicine or anything else. So when I came down to SGU, just similar to the US schools, there were very few women. In the charter class, there were 5 women. In my class, there were 16 women. And we all lived in these little dorms that were now demolished. And one night, one of the boys came to our room, knocked on the door and said, "You women are taking seats from men." So that was the kind of attitude it was.
Oh.
Into residency, and when I was an OBGYN resident, there was this really awful little man who used to just like come, and you'd be scrubbing your hands and he'd be like coming closer and closer to you. So, we had a lot of those sexual innuendo things that I think have changed now also. I applied for a fellowship and didn't get it. And then I was at a meeting and the chair of that department said to me, "Oh, Fran, I just hired a man who had the exact same credentials as you." So I just looked him in the face and I said, "My next life, then I'll be a man." And I walked away. So it was very sexist then. It was very different. And I think as a woman, and as a woman from a foreign school, I had to work really harder and I had to be very smart. But I think things have changed now, and 51% of women across all US schools are, and it's about 49% at SGU, so we're pretty even. And what we find is that our women students are really excellent. They're assuming a lot of leadership roles. And I think a lot of that old stuff has gone. So the barriers that the women have to climb over now, I think, is that glass ceiling of just continuing on upward mobility and having more women be in really senior leadership positions. And don't be afraid to do it.
Absolutely. Well, very well said. Anyone else want to comment on any barriers that you may have encountered along your career path?
I can speak to coming into not organized medicine, but into the corporate world as a physician leader and being a female amongst male medical directors and going to meetings and just being brand new on the scene in the corporate world. You don't realize how you're perceived as a woman. And sometimes women can come across, if they're passionate about a topic, it can seem emotional. And overcoming that and being taken seriously means a lot of times to not show that passion that a man might be able to show. And it would be like, wow, he was really, impressive with that presentation. But if a woman did the same thing, it might be perceived as, the passion can be perceived as emotional. So overcoming that and being taken seriously in a setting where it's a male dominated thing, and just being able to be cool, calm, and chill and ask a lot of questions, and leadership development was key. But the perception of not being an emotional woman was something that I needed to make sure was never going to be that perception. So that's something to overcome.
Oh, I'm sorry.
Go ahead.
When I worked at Montefiore, there was a senior woman who was very strong. And my boss said, "Franny, why is so-and-so such a bitch?" And I said to him, if she was a man, you would just say she was strong. So there's also, it's not only the emotion, but it's that you're a nasty person. I think a lot of that is gone now. What is it like for you, Dr. Jean?
I actually wanted to chime in on what you ladies are stating, because there's an added, I agree 100% with everything you're stating. And unfortunately in this career, too much emotionality does a disservice to us as women. I think that's very clear. One thing that I experienced during my fellowship, which was very new for me, because I'm in pediatrics. For the most part, people know people in pediatrics are overly happy-go-lucky people and just have been like that really most of their lives usually. then I got to and I'm from New York. I'm from the East Coast. East Coasters are passionate people. We say how we feel, and if we love you, we love you. And if we think there's things that could be corrected, we might gently let you know. Some people maybe not as gently. However, so now when I arrived in Cincinnati, a dynamic that I experienced a lot was, it's interesting, as a woman of color, I would be told when I would stand up or be assertive on an item that I'm being aggressive, why am I coming off so strong? And where if my cohorts that maybe were a lighter shade than me, they, male or female, that maybe were stating the same item or same what have you, was received well. And this bothered me a lot. It was something that I even made sure to go to. They have professional development things, at different hospitals and larger hospital organizations, to figure out how am I coming across? How is there something I'm doing that, unfortunately, maybe making other people feel uncomfortable? Long story short, I just reminded myself, and I was told by mentors, if you're doing right by your patient, if you're being respectful, you're doing nothing wrong. And if someone can't handle your gusto or your assertiveness, that is an issue for them to work towards and work on. And and so I want to share with my maybe darker toned females listening out there, that is, if you haven't experienced that already, that very much might be an added factor that you might have to experience as a female, and be cognizant of it. Perhaps step back a little bit more so that you are not bringing that added potential energy if it has something to do with you. But also know that there's a lot of struggles that we work with in this country and worldwide in regards to race and skin tone, unfortunately, that we're making a lot of progress with. But in the interim, as we continue to make progress, we might still be dealing with these subtleties.
Absolutely. Anyone else want to share any barriers, that maybe you encountered along your career path before I move on? Yeah, I mean, I think one thing we can all agree on is that, we've all had some sort of, barrier through our training. And, even with myself going through oncology fellowship, I mean, this is an intense program. And I have to tell you, when I was a first year fellow, I was the only female in my program. I had all male co-fellows. I could not believe that. And the majority of my attendings were men. So I was really in a place where it wasn't uncomfortable because I'm a people person and very compassionate. And clearly that's why I went into oncology in the first place. But it was really challenging. And I had so many barriers, especially that first year of being the only woman, because I do want to say I did have wonderful co-fellows, but they would take me under their wing and, kind of protect me as like their sister in a sense, which was appreciated. However, treat me the same. And I was, wanting a little bit more, to be a little more autonomy and show them that I could do this too. So I think one thing we can all agree, again, we have had many barriers throughout our training, and there's definitely ways to overcome some of them. So thank you guys for sharing those experiences that you had. So I want to go into actually a different topic. So kind of changing gears here and talking about work-life balance. So super important. I still have so much to learn on this topic myself as well. So the question I'm going to ask the panel now is, how do you balance your career with your personal life, wellness, and other passions and hobbies that you may have? So I will first direct this question to Rafael, and then I would love to hear what everyone else has to say about that.
Great, thank you. I want to start by saying this is a continued work in progress, ladies. I don't think anyone has the full answer for this, because as situations in our life morph, our balance is going to look different. One thing I can say so far that has served me well in my career is that I had to become non-negotiable with giving light and life to activities that bring balance to my mind, my body, and my spirit. When I focus on just those three main things, I found that they encompass so much of what keeps us grounded and keeps us sane, so we don't lose it. For long story short, as far as mind, you have to feed yourself with positive thoughts. There's a lot of imposter syndrome that many people in the medical world deal with and feel. And, you have to remind yourself, if you could not have gotten into this place that you're at by chance. There are many steps that we needed to go to in the vetting process to get to where we are. So we absolutely belong where we are and deserve to be where we are. So walk in that light and walk in that purpose. Body, literature shows how vital physical activity is for, reducing stress, reducing physical tension, and just adding further balance. And for me, spirit, this could look different for everyone. It could be, going to a institution of spiritual growth. It could be meditation. It could be yoga. It could be journaling. Whatever it is for you, just feed it. And the more you are feeding those three aspects, I find that the more we are each able to balance the stressors and whatnot that comes through our life. In addition, there were two more quick points I want to add. Number 2, don't be afraid to follow your own timeline. We are in a career where there's a lot of type A personalities, and everyone's going to be like, you got to do this on this time. You got to, take your boards right away here, ... And then a funny thing called life gets in the way and reminds you that, our timelines are a matter of laughter and giggles. So don't be afraid to follow what works best for you and your loved ones and your family. And that too will help decrease stress in your life. And lastly, one thing a mentor in fellowship shared with me, which has been serving me well, is that when one vacation ends, start scheduling your next one. And that is so that you really prevent burnout. Burnout is very real. There's much literature on burnout, the effects, how subtle it could start and build up and just be really all encompassing, lead to anxiety and depression. So I make it a point every 3 months, I will take a week off, whether it'll be a staycation or a go away vacation. But really, that's helped me. When one ends, start planning your next break.
Yeah, that's fantastic. I want to hear a little more about this topic. What else are you other amazing women doing to balance your career with your personal life? Anyone else want to share with us a secret, anything? Yes. I want to hear it.
I'm going to have to give the pre-COVID answer because before the pandemic, I went to so many concerts. I love going to see live music. I just love it. And I coffee blog. So I work full time, but now that I'm not in clinical medicine, I'm not on call on the weekends. I only work one Saturday a month, part of a day, seeing patients at a clinic. But there are weekends that I'll just go away for the weekend and find the most unique coffee shops. And then I'll write a blog about the coffee shops in Little Rock, Arkansas, Nashville, Tennessee. I'm going to get back up to Oregon because they have great coffee up there. New York City. So I love coffee blogging, live music. If there's a film that comes out, I'm there. I'm watching every film. So when I was in internship, I was pregnant with my daughter, had my daughter, and finished residency, which was very difficult. And being a single mom after that, after I finished residency, I was a single mom then. Raising a child, you don't really have a lot of work-life balance. You're making sure that you give everything that your career needs and everything that your child needs. There's not a lot of time for you, and you don't regret that. You just revel in all the joys of raising your child. But now that my daughter's in college, and you guys will all be there someday, Some of you already are. When your child is grown, this is my time. I am going to shows, going to films, enjoying coffee at the coolest places, and have the full support of my daughter. And when the pandemic is over, I'll resume that type of stuff. It's not safe now. So it's been now a time of reading and Netflix, and some coffee shops wanting to be safe during the pandemic. But on a normal year, I would be going to every concert, from the Eagles to saw Tom Petty twice the year before he died. I mean, how cool is that? Fleetwood Mac, every country artist you can imagine. So that is really my work-life balance. Is I work hard and then I play hard, because I'm just trying to live in each moment. And mindfulness is very key too. I know I have a lot of friends who enjoy yoga and other ways of practicing mindfulness, but I journal and pray too, and try to be mindful. But those are some of my activities that I encourage everyone. When you get time, just go enjoy a show and don't sit there, get up and dance and look silly.
I find this work-life balance discussion in general to be very elusive for me in particular, but it's reassuring to hear from you that I have 17 years until I can have some time back to myself with a just turned 1-year-old and a 4.5-year-old at home, because I hear you. I hope it gets better as they get bigger, but I find, all these, even in the best circumstances with a good work schedule, you still have all these second shift duties once you get home as a working mom, no matter if you're a physician or not. But I think physicians in general, because we're subject to a patient schedule, a clinic that runs late, or I'm a radiologist, I just had a contrast reaction, the last patient of the day, things that you don't get to clock out at 5:00 like other women in other professions do. And then you come home and it's food prep, get dinner on the table, quick, everyone take a bath, everyone in the bed, and then you're exhausted. So 17 years I have left.
No, I have a cardiology friend that bought scrubs for his children, and he would bring them on rounds. And I would bring my daughter on rounds on the weekends when I would see patients. And my daughter would sit in the physician lounge, and then he would show up with his 2 kids that were wearing their little doctor scrubs, even though they were young. And we just found ways to bring the kids with us.
Yeah.
And of course, I'd pull up in the hospital parking lot and my daughter would say, "No, not the hospital again." She didn't like it, but it was a way for me to, bring her some snacks and spend some quality time. So you just grab those little moments.
Yeah.
Yeah. Well,
right now, but it's not.
Yeah. Go ahead, Fran.
We should raise our hands probably. One of the questions that the students at SGU always ask is, when is a good time to have a baby?
When you're 16, right? You're an OBGYN. Isn't it 16 is like the best age?
There's no good time as a physician. Right. I mean, when it comes to, work-life balance, I find that women are in a different situation than men when it comes to that. Because I think that men live to work. Their work defines them in many ways. Their career path, and success to a man is not necessarily having 3 children. It's really what they do at work is often how men, I don't want to categorize and, I don't want to make blanket statements, but I think men live to work. But I think in general, women work to live instead of the other way around, right? And, take care of our children and work to sort of do all those other things that we feel we also have to do, like be good daughters and be good sisters and be a good wife and be a good mother and, all those things. So I think there's differences to men and women when it comes to work-life balance. But I also think that women they question, when is a good time to have a baby? And especially when it comes to leadership, a lot of women are their own worst enemies because they're afraid that they can't juggle a family and a leadership position, whatever that might be, and work, the clinical work, leadership position. And I find women around me questioning that. Well, I don't have, I'm going to have a baby, or I'm pregnant. How can I possibly be a director or take on another responsibility? And what I say to that is never say no. If you have an opportunity to do things and people are asking you to either do something or step up, it means they believe in you. And don't say no, because Margaret Thatcher ran England and brought up children. Okay. And many, many women across the world and across history have done amazing things and have brought up children very well. And so I feel like I'm living proof. I have 2 children. I'm remarried, so I have 3 more. So I had 5, but basically had 2 children. I have been the director of so many sites. I've been the vice president of a company. I've been now I'm a regional. I've taken on so many things. I've been on boards. It just goes on and on. But my kids, they grew up well. They didn't need me super close. So I know you have another 17 years, Jen, but your kids will surprise you. And remarkably, they don't need you as much as you think. And my kids learned how to make, a dinner, a pretty good dinner, not on the stove, for themselves at a very young age. And, they learned how to manage my absence. They learned how to be flexible. And today, my son is in SGU medical school in his first term. And my daughter is graduating law school in May. So, I wasn't there, but I was an example to them. And they have, once they grow up, and you're going to find your kids too, Jen, will say, after 17 years, like, wow, Mom, you're cool stuff.
Good.
And when my kids first said that to me, in like their teenage years, I was like, they appreciate what I do. And you're really a model. And so go for it. And don't ever think you can't do kids and you can't do concerts and you can't do yoga because you don't have the time. Because in essence, we can do it all. We can do it all.
I love this. That is great advice, Gina. I love that. Thank you for sharing that. And, that's great advice for me, who's recently married and thinking of, starting a family. And whether I was having children in residency or children in fellowship, or even as an attending, it really does impact us at all these different stages very differently. So great advice that I think that anyone can use in any stage of their medical career. So thank you guys for sharing. This is a great transition into a burning question that I have. And really this is for Angela and Gina, because you guys are powerhouse, executives. I want to know what advice you have for women that are maybe looking or thinking of an alternative career in medicine. So maybe research, administrative, they want to be a CEO of a company, something like that. So Angela, I'll start with you. What advice do you have for women that may be looking for kind of that alternative option, maybe not seeing patients every day?
I started taking some courses. They were leadership courses at one of my jobs, actually. I was at a hospital employed position at a clinic, or I was really the head of that clinic because it was a geriatrics clinic. But I started taking leadership courses through the American Association for Physician to a lot of the leadership things, healthcare finances, Six Sigma, so many of these principles that I hadn't learned up until that point. And that for me was really a way to transition over to the administrative side. It was when I was nearing the end of that training and those courses that I was offered my first, job in managed care, we'll say. And I was just so thrilled that I was getting an opportunity outside of clinical medicine, because in geriatrics, for a time, it was really difficult to make a living taking just geriatrics and what Medicare. I mean, I had like over 80% Medicare patients, approximately 80%. And when I had the geriatrics clinic, it was all Medicare. Well, that doesn't really support a physician. When you look at the overhead and what the Medicare reimbursement going to work out. So I took that first medical directorship, and it was for a Medicare Advantage plan. And what I said was, I'm going to channel this energy and this passion and all of this that I have for geriatrics into working with a Medicare Advantage plan and making access better for geriatrics and improving quality and reporting quality, and just work from that side. And maybe I can make the system better for all geriatrics. Instead of helping my 1,000 to 2,000 patients, I can work behind the scenes and make it better for everyone. So that was really what drove me into the managed care and then utilization management, and now an ACO setting. So that's what I did, was take some courses and speak to other women leaders, got involved with my own leadership organizations like the ACO that I was involved in, and quality committees. I have been busy doing leadership type stuff since I was at St. George's, even doing student government, peer counseling, and jointly forming the emergency physician club with them, with another student who's an emergency physician. So the leadership stuff was there. It just wasn't something that I had the opportunity to really explore. And taking those classes, which doesn't have to be through that organization. Some of you have other degrees. I heard there's at least one master's degree on the call. So sometimes you already have those skills and you have that knowledge, and you just really haven't applied it in an area where you can be more of a leader, whether it's in the clinical setting or in an executive type setting like I do. But if you're leaning towards executive work, that's something that's an option for you. And just talk to other female executives about how they got into it and what their advice would be, which would be a good time to get a mentor, actually.
Yeah, exactly. Gina, did you want to add any additional comments to that?
I just want to say, because I know we're running out of time, but I do want to say something I said before is never say no. If someone asks you to do something, whether it's your leader or a mentor or somebody else in a position of power, and they ask you to do something, physicians will rarely ask another physician to do something if they think you can't do it. So if they're asking you, it means they think you can do it. And say yes. It's the smallest of things, because what you'll find out is that little bit of experience is a little bit more than someone else. And it's usually, they're not asking you to see more patients. They're usually asking you just to make a schedule or run this program or do a Six Sigma, something or other. Never say no. And I decided very early in my career to not say no. And it has taken me on trips that you cannot even believe. It's opened up my world, because there's so much out there in our careers. I mean, I still see patients. I still, go work clinical shifts. But by not saying no, I have been somebody that a lot of people turn to. Hey, we have this weird program. We don't know what to do with it. Can you do something with this? And I've gotten into situations that I would never have been before, and I've learned so much and come so far. And so we're all leaders, and we can do, as I said, we can do it all. And just don't say no. And don't be afraid to say yes. Put it that way. And that's my advice for getting into all the other things that are available and open to you, whether it's leadership positions and research positions and all those things. You got to start saying yes. And that's all I got.
Well, ladies, this was an absolutely wonderful session. I really enjoyed speaking to all of you and asking you all these questions. And it was just really a pleasure to have moderated this event for National Women's Physicians Day. Everyone who's listening at home, please join the SGU Alumni Association. Again, there's so many mentors in the group that we're able to help set you up with, and including ourselves as well. So thank you again for joining today, and happy National Women's Physician Day.
Thank you. Bye.
Bye.
This is Bob Elick again. It's impossible not to have been inspired by these women physicians, their stories, and their impact on healthcare tonight. I, for one, am incredibly grateful again to our panelists and to the many, many women who have participated. Have a terrific night, and we look forward to continuing to celebrate SGU alumni virtually until we can meet in person. Take care.
Good evening, everyone. I'm Sumit Ball from the class of 2013, and I'm an interventional radiologist in Brooklyn, New York. Thank you all for tuning in to this wonderful event that celebrates the woman physician, and to SGU for giving me the honor of leading a guided meditation. As our school is the second largest source of doctors in the US, it is by extension the second largest source of women physicians in the US. I'm proud to have trained with my female physician colleagues and friends who now practice as close to me in New York City and as far as Southern Africa. In a time where unity is paramount, I stand beside you in protecting our patients' mental and physical health. Okay, let's get started. I know everyone has varying degrees of experience with meditation, so we'll keep it simple with 2 techniques that you can do anytime and anywhere: mindfulness meditation and compassion meditation, which we'll transition from one to the other. My hope is that anyone who maintains a regular practice of just 5 minutes a day can realize a greater presence of mind, even-mindedness despite challenging circumstances, and cultivating deeper compassion for loved ones in the world. You'll be happy to know there is tons of scientific research out there supporting the effectiveness of these techniques. So, to begin meditation, posture is everything. The first thing I want you to do, wherever you are, sitting from work or home, is to sit in a chair. That's probably going to be the most comfortable thing. And I want you to sit with your back straight, basically your spine erect. I want your shoulders to kind of be square, kind of slightly back, but relaxed. It's very important to keep them relaxed. I want your chin parallel to the ground and your hands just like this with palms facing upward and just relaxed on your thighs. And what you're going to do throughout this meditation is you're going to gently lift your eyes to the point between your eyebrows, just right over here. Not too high, because then you're going to get a headache from straining, and you're going to realize when you drop them, when you're just going to basically feel it when your eyes have dropped. So what I want you to do is keep your attention on this point between your eyebrows. Most of the meditation, especially the mindfulness part of it, is going to entail breathing in through your nose and out through your nose. And all you're going to be doing is basically being a passive observer of your breath, watching it go in and watching it go out. Watching it go in, watching it go out. And that's basically it. That's the key of mindfulness meditation. But before we do that, as I mentioned, posture's number 1, and there's a couple of preceding things that you can do to get started. One of them is going to be to energize your body. One of them is going to be to drop down into a little more concentrated state. The other one is just going to experience stillness for a few moments. And then the next part's going to be mindfulness and then compassion. And we'll be done. And it only takes a couple of minutes. So here we go. So what I want everyone to do get in the right posture. As I mentioned, spine erect, shoulders relaxed, chin parallel to the ground, and your eyes gently lifted to the point between your eyebrows, palms facing upward on your thighs. And we're going to do a little bit of energization here. So what I want everyone to do with me is we're going to do a double inhalation, meaning through your nose, and you're going to tense your body, every single muscle in your body for 6 seconds. And then you're going to exhale a double exhalation and release all the tension. So here we go. Breathe in. Tense every muscle in your body. and release. And that's how you're going to drop yourself in to the energization part of it. Now, what I want you to do is we're going to go into a concentration meditation. You can do to a count of 20, breathe in, hold your breath for 20 seconds, and then exhale for 20 seconds. This is all through your nose and out through your nose. Keep in mind, you may not be able to do 20 seconds, and that's okay. If you can do 10 seconds, that's completely fine. Just make sure that when you breathe in and you hold your breath and you breathe out, it's all the same amount of time, the same interval. So we're going to breathe in. Let's keep it simple, and we're going to do 10 seconds just for everyone. So breathe in through your nose. Hold for 10 seconds. And breathe out through your nose for 10 seconds. Now, I'm going to take a nice deep breath in and let it out through your nose. And don't breathe back in if you can't, if you can hold off as long as you can. Just enjoy the stillness for a moment. And whenever you feel the urge to breathe in again, at that moment, breathe in. So now, again, spine erect, shoulders relaxed, palms facing upward, chin parallel to the floor, and your eyes at that point between the eyebrows. And just watch your breath. Be a passive observer of your breath. No need to control it. No need to control anything. Just be here, here and now. Whatever happened during the day doesn't exist in this moment. Whatever's coming up next doesn't exist. We're just here in this moment, all together. If your back starts to slouch, no worries. Just slowly and gently bring it back. If your mind wanders, no worries at all. Just bring your attention back to the breath. If your eyes dropped away from the point between the eyebrows, just gently lift them back up. Just watch your breath. So now, sitting completely still, your eyes still closed, envision yourself in a cool, calming light. White light, a yellow light, whatever appeals to you. And feel a great sense of love for yourself. And that's okay. Not a selfish love, just a forgiving love of all imperfections, accepting yourself as you are. Now expand that love beyond yourself to your immediate family members, your children, your parents, your spouse, boyfriend, girlfriend, whoever may be in your nearby vicinity. Send that love to them. And take that love even further and spread it to your patients. Imagine a world where physicians not only work with science, but a compassion, a great love for what we do. Let them feel that unspoken element. Do you have enough room in your heart to spread love to them for their needs? Let's expand that love even further to your whole town, whatever city you live in. Envision all those people. Do you have enough room in your heart to love them as yourself? Each person with their own wants, needs, desires, all looking for the same thing we are: happiness. Do you have enough room in your heart to love them? Expand that love even further to whatever community you live in beyond that, whatever state, province, wherever you're coming from. You have enough room to love them as yourself. An ever expanding light. Picture your whole country, all the unity you feel with all the people of your own country. Do you have enough room in your heart for them, all seeking the same thing: love, peace, happiness. Now expand that love to the entire world. No matter where all of us are right now, all tuning into this event together, different points on the map, we can all envision one world engrossed in that light. Do you have enough love for every single person? Feel it from the core of your heart. Just sit for a moment and be still with that. Now gently lift your eyes open and just be in the stillness. So there's my intro to meditation. As you can see, it only requires a couple of minutes a day. You don't have to be perfect at it. It's something that you can do anytime, anywhere. And the whole idea is just get started. And you can shorten any versions of these. So as just a recap, the first part was the energizing your own body. So inhalation through your nose, tense for 6 seconds, exhale through your mouth with a double exhalation. Right after that, you can do a 10-10-10 or 20-20-20. Just keep in mind, whatever it is, just the same interval. Breathe in for 10 seconds, hold it for 10 seconds, out for 10 seconds, whatever interval works for you. Lastly, after that, just take a deep breath in, let the breath go out, enjoy the stillness for a moment. And then after that, you go into the mindfulness, which is what we were doing, was just basically just being present, being conscious of our breath, not worrying about the mind wandering, just being totally present with ourselves. And then if you've got time, which is a separate technique, you can go into the compassion portion of it. However you want to recharge yourself for that day. The whole key is just be regular, be committed. All of us went into the medical profession. It all took commitment. If we can do that, we can do this. And it only takes a few minutes a day. Tell your friends, tell your family, you can do it together. And if anyone has any questions or concerns, you want to learn more, you can reach out to me on social media. My Instagram handle is on the link. I want to make sure I'm accessible to help others through this, because I've been doing it for over 20 years and I'm still learning new things every day. So you can find me at SumitBallMD, and also my email address, sbahl, SBAHL311 @gmail.com. Happy meditating, and it was really wonderful to be a part of this. Thank you, everyone.